What I'm learning today. Hey, Dr. Hillary Frederickson, how are you doing today? We're talking about how doctors who've been practicing a really long time just had incredibly surprising results. So it's really interesting. You and I ran a group program with a bunch of people. We did food sensitivity tests. We were looking at a lot of different things. And after how many years have we used this test? The results were a clear pattern and completely shocking.
A clear pattern and completely shocking and different than anything we've seen.
Right.
So yesterday I was having dinner with one of my dearest friends who I've practiced medicine side by side with for 20 years. We've been doing it. She's an integrative pediatrician. Her name is Sarah Benes. She's amazing. And we were talking about how things are really medically harder than they used to be. Like we're having to work harder at things. Mm-hmm. And we are seeing like people with it just takes more to get people healed up and well. And she's a pediatrician, so she's been working with a lot of teenagers that have kind of this leaky gut, leaky brain thing. And we keep talking about how there's this leaky gut, leaky brain. And I was telling her, oh my God, Kara and I just did this big group of all these tests, and Sarah Benet has also used this test for years and years and years. And so I just said, well, you should have seen our results. Like it was like over, it was like 60% of the group, I think, had what looked 80% of the group, what looked to us like massive food responses, immune responses to almost all the foods that they are eating, or some bit of immune response, which we'll talk about later. And then I said, and many of them had a response to sugar. And many of them had something that's called a Candida albicans, which is a yeast that lives in our gut normally, but if it gets out of control, it can be a real pathogen in the gut. And she was like, that's so bizarre. Like, that's unusual. That's not normally what those tests look like. And I was like, I know.
That's what we said. But you make such a good point in just saying that all of our doctor friends, and when we go to conferences, you and I probably do 8 medical conferences a year, because we are curious people. And so we're with all different groups of people, we're across the board. We're not just doing hormone conferences. We're not just doing women's health. We're not just doing naturopathic conferences. We're with really diverse groups of doctors. And every conference, somebody gets up, one of the speakers, and says, is everyone seeing that people are sicker these days? Is this harder than when I was practicing in the 80s and the 90s? And it's so interesting to hear that over and over and over again. And we're all sitting there saying, what is the problem? I mean, it really is this crisis we're having in health. And then you and I, expect to have really clear results like we have for years and years on this test. And we're going to do this as a group and have it be fun. And we're going to do all these meetings and really dive into it with our people. And then we're sitting there with the results, flipping through patient after patient after patient, seeing this is a real problem. People's GI systems are suffering. What are we going to do about it then becomes the issue, because this test was just this sort of screen. It's just a food sensitivity test. It doesn't tell us actually what's going on in the GI system at all. So that's sort of where we left it of, now what do we do?
Now what and just this concept that, I mean, the great news is that it is becoming much more mainstream that gut health equals your total health, or that a big place to start is in the gut. And Kara and I were in medical school in the late 90s, and we were learning that, we were in naturopathic medical school in Seattle, Washington, which was like, I'm sorry, it was just straight up ahead of the times when it came to that. People were like, you always treat the liver and the GI tract, And if you get the detox working and the GI tract working, you're going to see systematically things get better, whether it's arthritis or it's migraines or it's depression. And so those are 3 things that you don't refer to a gastroenterologist for,
Mhm.
right? Because it's not a gut issue. But we have always learned you treat the gut. And it used to be pretty easy.
Mhm.
It used to be like patients would come and it was like, okay, I mean, all right, this woman has migraines, or this kid has recurrent strep infections, or, and so it's like, we're going to figure out, are there foods that they're eating regularly that they're having a reaction to? Back in the day, it used to be dairy and sometimes gluten, and usually like one of those two things would typically solve the thing. You give some probiotics, you do some degree of anti-inflammatory. Sometimes you don't even need that, and like voila, the patient was better. And now it's not like that. Now it's just
Yes.
the symptoms are more severe. And this is really like a post-COVID phenomenon. Like, so in 2020, whatever was really, the COVID virus itself, the spike protein vaccination, whatever it was, however we got exposed to all this new stuff, there has been a shift in, I think, people's total health.
Right. And I think we came up with a list of 3 things, right, that we're kind of considering as maybe these are the things, because the test results changed so much from a few years ago that we're wondering, is it something happened with is it COVID? We don't know. Is it social isolation, and is it emotional kind of loneliness and not being able to see people and missing all the things we do, all our life rituals for that time period? And is it the lack of germs we're exposed to, of, we weren't going as many places, et cetera? Did that affect people's GI health? Or, is it other things? So
But they also, the intense
oh,
increase
of course. And
in
the
the
sickness. Yeah.
antimicrobials that were
That
being.
was our number 3, exactly.
Yeah. And like that is when I said that yesterday with Sarah Benet, she's like, oh my God, of course. Like, of
Of
course.
course.
Because
Of course.
we know there's definitely
Mhm.
research that when you try to make yourself sterile, it has an impact on your gut microbiome. And listen to this fascinating thing. She said that she was speaking to a lactation consultant at UCSF who sees 20 patients a day. And Sarah Benet's like, Hillary, there's like a big thing. Like, the babies aren't as healthy. Like, she's like, normally I meet a new baby, the baby's really healthy, the mom's healthy. Like, taking care of babies is usually pretty easy. Like, a few of them have problems, but generally they're like, most of them are pretty good. A couple tweaks. Many of them are having serious milk allergy with blood in their stool, like much more severe. That's something that used to be very uncommon. And this lactation consultant that she was speaking of confirmed that. And that is a really interesting, scary thing. Like, so what we're seeing so we just had this big dinner, like, wow. And so
Can I go back to that though? So I just want to jump on that, because the mom's microbiome is passed to baby. So if Hillary and I came away from this group saying everyone's microbiome is having real issues and it's not what it used to look like, and we're not exactly sure why. But back to that hand sanitizer usage, I'm telling you, I'm at my clinic clearly right now, and I use, all natural hand sanitizer, but it works, and I'm spraying things constantly, and I'm wiping down acupuncture tables, and I'm wiping down doorknobs, and I use, what is considered sort of the natural alternative, but they're really strong antimicrobials. And even when I'm eating, if I'm eating a lunch where I'm using my hands and it's going by, I can still smell them on my hands. So me eating that food, if I'm having a handful of almonds, that hand sanitizer is getting on the food. It's going in my GI tract. It's killing the gut flora. And I think another big source is the chlorine in our water, I think, is killing our gut flora, which you need to chlorinate water. I'm not advocating for no chlorine in water, but filtering water is really important, because just even a basic charcoal filter, the Brita filters, those can really help as far as preserving your gut flora. All of the preservatives in our foods, if we buy packaged foods, even if they're using rosemary oil or any kind of preservative, it is meant to cut down on bacteria. And then we have a whole other thing does stress allow dysbiosis to happen? And it does indeed. So we have to really look at all of these factors and think about what's the underlying cause. But I think Hillary and I were just completely flattened, flipping through result after result after result. You have to keep in mind that usually we see results based on one person where we feel like there's a gut problem. So we'll order a food sensitivity test. We're screening these people, we feel like it, and we order it on them. And we have an individual in front of us. We're really focused on the individual and we see the results. So I think there are probably a lot of doctors out there looking at these and we're not making the connection as a whole because we're so focused on the individual patient. But if you do a group where they've self-selected of I have something wrong with me, I can't lose weight, my mood is awful, I'm depressed, I have anxiety, I have gas, bloating, headaches, rashes, I'm having hormone problems, I'm having infertility problems, I'm just not well, I'm not myself. Those people decided it could be a food and they did the test. And now we're seeing the majority of these people, vast majority, have a similar picture. That's not normal. But that sugar coming back really high, and that in people who I know how these people are eating, I know how people who even work for us are eating, and that sugar should not have come up that high. And then that odd candida was like off the charts. And so Hillary said, did they change the reagent? What is happening here? Nothing has changed. It's us. So these markers were just showing there's gut inflammation along the GI lining. There's going to be some kind of ramification with the foods you're eating. So odd foods are flagging, like carrots comes up. Are people really react? Do more people react to carrots? As many people as we saw in the test? No, that's not true. It's that they have GI inflammation as a result of a dysbiosis. But that test can't tell us actually what the gut flora problem is, what that microbiome problem is. And it's unbelievable to note what's going on with the microbiome in our GI system. There's 10 times more bacteria in our bodies than our own cells. So it's very hard for Hillary and I to look at this test that didn't even look at anything specifically GI. It just looked at food sensitivities and an immune reaction to foods. It's not an allergy test, it's a food sensitivity test. We don't know what's going on as far as the underlying GI system from there.
I'm like laughing. Sorry, I have a funny person that just walked into my screen in the background. But the one of the things I was interested in is also like thinking about where are we getting these? When you fly now, it's all like, and the plane has been fumigated to make the viruses go away. Like we got so psychotic about not getting COVID and everybody. And I'm not judging any of that stuff. We're just looking at the after effect. I'm not saying what was good, what wasn't good. That's all come and gone. But I'm just feeling like maybe we shouldn't. I fly United a lot. They hand me a thing right in the beginning. Everybody's wiping down their chair and they're already like, we've already defumigated the plane. And I'm like, what's happening here? We just, there's a lot going on. So
one thing I learned though, can I interrupt? That's ridiculous, is how few people actually did wash their hands before. So I think that was a positive in the last few years. People started washing their hands. I'm like, yes, that is awesome, because we do need to do that. And that was sort of a shocking thing that I learned during the last few years, is that was not a regular habit.
I know. I was probably like in no time.
That is really good. But do we need to wash our hands and then do hand sanitizer and then wipe everything down? I'm not sure that doesn't create us a problem.
I'm saying no.
For immune systems.
We already know, you see with kids in pediatrics, that when they play in dirt, they have a reduced chance of having an allergic immune system. So we're just raising the flag and saying, red alert, red alert. If you're hearing this and you don't feel your best, and I'm going to just say something that's so interesting about how you feel, just reflecting on myself this morning, laying in bed, and I was like, just in general, checking in. How do I feel? How are my systems? How's my brain? How's my fatigue? How does my body feel? You don't know when you're not feeling that well. Obviously, if you have a major system happening, flaring or migraines or hot flashes, or, those are major things where you're like, this is weird, joint pain. But in general, like sometimes it's hard to track our wellness, our vitality, and until you start to feel better. Like, so this is what happens all the time when we say to people, oh, look, you were super reactive to dairy. By the way, I've never seen so many people so reactive to dairy.
Right.
It was like, so I don't know if we're eating more bars on the run and they have dairy solids, or it's just dairy, dairy, dairy. And by the way, a lot of the dairy, mainstream dairy that you're getting at Starbucks with your latte or here or there, that stuff's all treated with antibiotics and hormones, unless you're somewhere where they are specifically saying they have organic milk that's not treated with this and that. But like the dairy supply itself is not, it's toxic. I mean,
tell what the antibiotics do to the microbiome, though. Make that link.
The antibiotics shift the microbiome. When you have daily exposure, I mean, it's one thing if we're using if somebody comes with strep throat and you're like, okay, we need to knock down that colony because one, there's negative sequelae from strep, or two, just like the host needs help knocking this down. Give a specific antibiotic that targets staph or strep for in the case of strep throat, and that colony goes down. Most of the bacteria in the gut are gram negative, but anytime you treat with low-grade antibiotics, you're shifting the gut microbiome. Some critters die, some critters thrive, and that's just how it is. And so we know, like, if you're even treating with amoxicillin, which is, you give tons of probiotics afterwards, you're putting good bacteria back into the system. You're using, I use Saccharomyces boulardii during antibiotic treatment to try to block any damage that's done. So like you're really making a big effort because you're attacking the body in some way. Anytime you're attacking one area, there is the rest of your system gets impacted. And when you're young and you're a little kid, it doesn't really matter. It's just that it's always like the straw that breaks the camel's back. So that's where we are right now. I think everybody had, like you said, the isolationism, the stress, and like we were saying during COVID, when death is on the table, when you're like, I could have potentially, I remember I spent so many days intensely checking my thermometer after I spoke to my beloved neighbor Nancy, who's in her 70s. And I was like, oh my God, what if I'm sick? Just like, why am I'm like tweaking about potentially killing Nancy. That was like a new stressor in my life. I didn't need that stressor in my life. And so that's like, and everybody had that on some level, right? And then all the antimicrobials, like, so it's just literally what we're saying. It's just a stacking event. It's not one thing. The antibiotics and the dairy, the multiple dairy. But at this point right now, if you are waking up and saying, I don't feel as vital, or something is off, or I'm not, the things I used to be able to do to get myself back to good health isn't having the same effect, you're not alone. It's happening. It's on.
And I just want to say, because I know that it could cause someone stress if they're listening to this, if they had to take an antibiotic recently, or they do have to take one. Hillary's main point there was, if you have strep, you take the antibiotic, but we know that you're taking the antibiotic, and we can take measures to support your gut microbiome while you're doing that. But if you're having dairy every day, or something that has a low level of an antibiotic in it every day, or my hand sanitizer that's getting in my GI tract every day, that's slowly killing my microbiome, then I have a problem if that's not at the forefront of my thinking, so sometimes we have to take these things. That's not our argument here. Our argument is, over the last few years, something has shifted in our GI systems and people don't feel well. So I feel like we really need to get to the root cause and really understand what's going on here, and then take action. So that's what we're talking about. And if this strikes you as something you want to investigate further, just click on the link below.
We'll help you. Yeah, we just all got to work together to get well. We're healing is possible at every moment. Like that's the amazing thing about our bodies. We regenerate, we heal. We know it's just that when we have information like this and we can go in and say, oh, okay, we just need to work a little harder in this area for rebuilding than we were used to or than the patients used to. Okay, that's just great information. And we've got a ton of tools to do that.
Right.
And people get better. Like you will get better. You just have to work a little harder at it.
The body is made to heal. We just don't know exactly what we're targeting based on what we just saw in these surprising results.
So more to come. Bye. Happy Friday.